Thank you for joining us. Today is our 11th State Technical Assistance webinar, and we are happy to have you. Here's a note about our funding sponsor. We are, CSN is funded by HRSA at the Department of Health and Human Services under the Child and Adolescent Injury and Violence Prevention Resource Center's Cooperative Agreement. We are HRSA's primary vehicle for technical assistance on child and adolescent injury and violence prevention. So all of this information should not be construed as the official position of the government. So audio right now, if you can hear us, you've logged in correctly. So please mute your computer speakers and also keep your phone lines muted. You can unmute yourself during Q&A, and we do have two options for muting. We do have some web links at the top. One is our paper that I'll be referencing today, and we also have today's slides available as a PDF for download. And this session is being recorded, and we will post it to our website as soon as possible. So without further ado, we will get started. So today we'll be talking about continuing our child safety work amidst disruption, and specifically we'll have two examples of how state health departments reassessed and pivoted their work during COVID-19. And so our agenda for today is that we'll start off with some systems thinking to kind of give us a frame of reference of where we are and how we set up our systems to face these types of disruptions. And then we'll look at, we'll hear from Louisiana about their continuing their suicide and self-harm prevention work through adversity. And then from Nebraska about how they refocused their teen driver safety work during COVID-19. And then we'll go into how the CSLC supports state health departments, and we'll focus on partnerships to continue supporting your system. So we do have a huge agenda today, and we'll get started. So our presenters for today are Nicole Cousins from Louisiana. And let me make sure I do her justice by introducing her. So Nicole is a native of New Orleans, and she received her Bachelor of Arts in Psychology with a minor in Health Studies in 2017 and her Master's of Science in Health Studies in 2019 from Southeastern Louisiana University. Nicole joined the Bureau of Family Health, Office of Public Health in February 2020 as a Data to Action Team Program Assistant. And she is the primary point of contact now for the Louisiana Suicide and Self-Harm Prevention Team for the Children's Safety Network's Child Safety Learning Collaborative. And Nicole's background in health studies, organizational skills, virtual learning, technology experience, and strong working relationships with team members allows her to excel in keeping the suicide self-harm prevention team on track and organizing, marketing, and supporting the Gatekeeper virtual trainings that she'll be talking about. What motivates her is knowing her skill set and support for the team partners are directly tied to advancing not only suicide prevention, but also other efforts put forth by the Bureau of Family Health to keep Louisiana's mothers, families, and children safe and healthy. Jeanne Bietz will be our second presenter. She has 25 years of experience in public health, and she currently coordinates efforts related to motor vehicle safety for the Nebraska Injury Prevention Program. She has been successful in developing the Drive Smart Nebraska Coalition, a group of collaborative partners, and in leveraging funding to implement a variety of motor vehicle-related activities. Teens in the Driver's Seat is an evidence-based program that she has implemented in Nebraska. The program has grown from 5 schools to 33 schools, which we're very excited about. For the last 5 years, she has been involved with the Child Safety Learning Collaborative and leverages that process for constant quality improvement in her work. She is also involved in the state's child death review process and is a child passenger safety instructor. Jeanne has also been active in the Safe States Alliance, currently serving as a committee co-chair, and had past involvement as a member of the executive committee. And then to introduce myself, I'm a senior training and technical assistance associate for the Children's Safety Network and co-manager of the Child Safety Learning Collaborative. I'm the team lead for the Suicide and Self-Harm Prevention team. I'm also the data manager for the collaborative and one of the co-leads for our health equity work. And I use my background in education and research to help state health departments improve their programming and outcomes. So thank you to everyone for joining us today. And I'll get started by introducing some work about our systems. So what is a system? A system is an interdependent group of items, people, or processes with a common purpose or aim. So in the system, it's not just the parts. So we have some organizations. We might have a division, a coalition, a program, a project, partnerships. It's also the relationships among these parts that become opportunities for improvement. So an example of this, and I'll slow down because my New Yorker is taking over. An example of this is that driving to work is a process, but getting a family out of bed, fed, dressed, and transported to work is school is a system. So because they're interrelated parts and everything needs to work together. So the advantages of systems thinking is that thinking of your work as a system, it enables you to better understand and manage the complexity. It allows you to anticipate and prevent unintended consequences. It makes it easier to spot and address challenges, gaps, or bottlenecks. It helps you identify and implement high-leverage changes and cross-cutting strategies. And it supports more rapid scale-up and spread of effective change strategies. Here are some elements of the system, of systems thinking. We have to start off with a shared vision that fosters a commitment to the long term. And this is really helpful, especially in times of disruption when we have this shared vision and a very articulated aim. We have mental models that focus on the openness needed to unearth shortcomings in our present ways of seeing the world. We have team learning, which is developing the skills of groups of people to look for a larger picture that lies beyond the individual perspective, so making sure that everyone is on board. And we have personal mastery that fosters the personal motivation to continually learn how our actions affect the world around us. And that often people are steeped in the reactive mindset that someone or something else is creating our problems. So systems thinking as a discipline integrates all of these 4 disciplines of a learning organization. It keeps new tools from becoming the latest trend in an organization and motivates us to see how disciplines and respective practices and tools interrelate. So for example, having a vision without systems thinking paints a lovely picture of the future, but it doesn't create this deeper understanding of what must be done in order to make that vision a reality. Systems thinking and practices then can lead to genuine belief that the vision can be realized. So it's articulating that vision for the future and putting the correct people and skills in place in order for that to happen. So, of course, I like using this fish and connect the dots to talk about this because depending on where you are in the system, you may not see the whole picture. So if you're a state health department and you're articulating your system, you may know that the end result of this connect the dots is to see a fish. But if you're an individual partner that's only on a fin or only on a tail, you may only see the dots that are next to you. And so you might not see how your work is relating to the larger system. So it's the job then of the state health departments that are leading this work to articulate that system and let the partners know of, hey, you might only be working in this bottom fin, but it's actually really important that you continue this work, because without the spin, the fish doesn't swim. Another way for you to look at this is through a systems map. And we do encourage you to look at the link at the top. That's the CSN Framework for Quality Improvement and Innovation. That's really a workbook on how to do this. So we have the components of the system, and we always start off with our aim at the top. The aim of the system, that final vision of what do we want, what do we intend to get out of this. So if you're trying to decrease deaths by suicide, you would have that aim at the top. Then you have the inputs on the left-hand side, and these are the individuals and organizations involved, the resources that are required, your clients or beneficiaries. And in the middle, we have all of these processes that may be standalone processes, but then you can also show how they interrelate to one another to create then your outcomes on the right-hand side, looking at your measures to make sure that your work is continuing and getting to your ultimate outcomes, which is that decrease in hospitalizations and deaths by suicide. So let's look at how we can understand our system. So we want to focus on the structures, relationships, processes, and patterns rather than on static or isolated events. And so this is where it comes, systems thinking is really important for events like what we've just been dealing with for the past year of this huge disruption due to COVID-19. By having a very articulated system, it helps us move beyond these events, because we can rethink, reassess our work, rethink, and re-strategize how we're going to continue our work and continue working towards our vision. We can recognize that the cause and effects are often separated from one another in time and location, making it difficult to see the connection between them. And we can also understand that an action in one part of the system could have unintended consequences in a different part of the system. So this, we have some examples here, and we've seen this a little bit in the team that I lead on the Suicide and Self-Harm Prevention team in the CSLC, where in the second example, improving or increasing screening for suicide risk within a healthcare organization may reveal a lack of capacity or training to provide treatment and referrals for those that screen positive. Or another example would be focusing on preventing bullying in one location within a school may result in its occurrence or escalation in another location within that school. As some other examples here are increasing distribution of child safety seats in a county may lead to a need to address incorrect installation of seats in that county. So just distributing the seats is not enough. We also need to teach everyone how to actually install them. Increasing the prescribing of opioids to reduce pain may inadvertently contribute to an increase in opioid addiction. So we see that, when we're working in one part of the system, because everything is interrelated, we might have some unintended consequence in another part of the system. So we want to look at our key components of a system. And in an earlier stall, we introduced the importance of developing your purpose and aim, the relationships and processes that take place. And in this stall, I'd like us to focus and keep our mind, of course, always on the ultimate aim, but we want to focus on the relationships and individuals and organizations that exist within your system. And these are the relationships and partnerships that are vital to keeping your system going, especially in times of disruption. So if we look a little bit about our website, and yes, Jenny just entered, this is really good for everyone to know that you can access all of our prior STAL, State Technical Assistance webinar recordings and other CSN events on our website. So that's all available publicly. So some key components of the system. We're going to focus, like I said, on relationships. So we want to encourage our partners to think about the system, and we know that system change requires buy-in. So when we want them to have an idea, whether you're using that formal components of a system map or even a more simplistic diagram, like to connect the dots, We want to make sure that everyone understands how important their position is within this system. We want to identify the interactions and connections that are necessary to complete our work, and we want to broaden operations planning to include more components of the system. We want to describe the system using maps or linkage processes and promote regular visits and other interactions between departments, agencies, and other system components. And this is an iterative process, so that's why it's showing you here that it's a cycle. Wherever you start, you can continue going, and this can continue evolving. So your system is not static, it's a living being. And it moves with people and with changes and ideas. So here we'd like to hear from you a little bit about who are some of your key partners. We have some traditional partners in our work. It's usually hospitals, school systems, healthcare systems, Department of Transportation, and then we also have some non-traditional partners, philanthropies, businesses, law enforcement coalitions. So we'd love to hear about some of your key partners. Who's helping you do this work? I see a number of folks are typing. I'm happy to see that. Great. Is anyone willing to unmute themselves and share who are some of your key partners? Who's helping you do this amazing work? Great. Jeanne shared that they're partnering with schools, highway safety, insurance companies, MCH, FCCLA. Great. Jane in Louisiana is sharing community-based organizations, Department of Children and Family Services, Child Welfare Training Academy, Suicide Prevention Advocacy Agency Foundation. Wonderful. Wonderful. Great. Nicole in Kentucky, Behavioral Health Agencies, State Agency Partners, Behavioral Health Regional Suicide Prevention Coalition, Hospital Network. Will in Washington, Safe Kids, Traffic Safety Task Force, EMS, EMT, PTA, school associations. Wonderful. So this demonstrates how broad all of your partners may be. And Rhonda in Florida, Behavioral Health Association, Building Healthy Military Communities Liaison. Great. So I'm glad to see a number of different types of partners. And it's always important to have different types of partners, even if you're working on very similar items, because this is what helps us in times of disruption. So we have experienced a lot of disruption in this past year, and we've had examples of natural disasters preventing our work from occurring, funding changes or funding redistribution. We've had civil unrest, and of course the biggest disruption of all has been COVID-19. So we want to think about how we can use our partnerships to reassess and pivot our work during this past year. So how have you done this? We'd love to hear from you about how have you had to reassess and pivot your work during this past year. And if you would like to unmute yourself and share it, we would love to hear from you. Or you can type in the chat at the bottom as well. Would anyone like to share how they've had to reassess and pivot their work? I see Jane is typing. Jane, would you like to unmute yourself and say hello? All right. It seems that everyone is shy today. So I will...
No, Maria, I'm here.
Oh,
sorry, my phone is Yeah, no, I was just typing, stay tuned. Nicole's about ready to tell everybody how Louisiana pivoted their work. So,
Great. Okay, so then keep this in mind. You can continue chatting if you do think of anything that you would like to share. You can enter it in the chat. But without further ado, I will hand it over to Nicole to share what they've been doing in Louisiana. Nicole, thanks for joining us today.
Thanks for having me. Hi, good afternoon or good morning to you all, depending on where you're hailing from. My name is Nicole Cousins, and I'm the Data to Action Team's Program Assistant with the Louisiana Department of Health, Office of Public Health, Bureau of Family Health, and I'm also the Suicide and Self-Harm Prevention Team Lead for Louisiana. Thank you all for being here today, and I'm going to be talking to you about our journey with the Child Safety Learning Collaborative and how we've evolved over time through adversity that was 2020. So Louisiana is one of the 7 states working on the suicide and self-harm prevention. In order to address suicide rates among young residents in Louisiana, the Louisiana State Child Death Review has been participating in the Children's Safety Network's Child Safety Learning Collaborative since 2019. According to the 2019 Youth Risk Behavior Survey, 17.7% of Louisiana high school students reported that they seriously considered attempting suicide, and 15.2% actually attempted, which was statistically significant and higher than the U.S. average of 8.9%. In 2019, Louisiana ranked 24th in the U.S. in the rate of suicide in children ages 10 to 19, and Louisiana is now participating in cohort 2 of the Child Safety Learning Collaborative. Upon joining the Child Safety Learning Collaborative, we chose 2 strategies to focus on. The first was to implement and spread a valid and reliable screening tool for suicide risk among school care organizations. And the second one was to implement and spread evidence-based gatekeeper training within schools and other organizations working with youth. We formed partnerships throughout our process. We have the Office of Public Health staff that are assigned to Child Death Review, our Region 4 Maternal Child Health Coordinator, Deborah Feller, the Office of Public Health Region 4 Medical Director, Dr. Tina Stefanski, the Office of Behavioral Health and other local governing entities, suicide and self-harm prevention staff, which includes the Family Tree and Jacob Crouch Suicide Prevention Services. We have the Training Coordinator from the Department of Education, the state and local adolescent school-based health programs staff and behavioral health staff, the Director of Emergency Medical Services for Children, Amanda Perry, the Bureau of Family Health's Injury Prevention Manager, Kristen Sanderson, and the Emergency Department Surveillance of Non-Fatal Suicide-Related Outcomes, or ED-SENSRO as we call it, Communication Specialist, Jason Lochman. Our first efforts started in Region 4, which is the Lafayette or South Central region of Louisiana, with an assessment of best practices in schools for screening and a pilot project to establish or improve screening of suicide risk for children and adolescents in hospital emergency departments. We offer subject matter expertise, coaching, and evidence-based approaches to reduce suicide and self-harm among children and adolescents. We chose the Columbia Suicide Severity Rating Scale to be implemented in a large regional pediatric emergency room. The team expanded to 2 other hospitals in Region 4 and was planning on starting to expand to Region 6 or the Central Louisiana Alexandria area. The hospitals involved were asked to provide basic de-identified data on the number of screenings and screening results. Hospital pediatric and emergency room leadership were given screening workflows, HRSA guides or Health Resource Services Administration guides, safety checklists, parent education handouts, and other resources. We cultivated a partnership with the Emergency Medical Services for Children to assess statewide emergency rooms screening of children and partnerships with pediatric readiness efforts. So after 2 years in the Child Safety Learning Collaborative, one hospital had implemented a screening tool for suicide, and 2 others were considering implementing. And the team was discussing expanding to Region 6, and at this point, making progress became difficult. COVID-19 overloaded hospitals, which shifted their priorities, and Region 4 was heavily impacted by Hurricane Laura and was subsequently impacted by more hurricanes that came through South Louisiana. We had 3 that hit. The big ones were in August and October, and we were in the cone of concern and on alert for 8 named storms for that season. The team had to reevaluate the feasibility of continuing with the current intervention and our value of participating with the Child Safety Learning Collaborative, and we ultimately decided to shift gears to our second intervention, which was gatekeeper training. We met with the Child Safety Learning Collaborative to discuss our next steps, and in order to accommodate our new goals, I took over as team lead. We partnered with the Family Tree Information, Education, and Counseling Center and the Jacob Crouch Suicide Prevention Services. We had a change to our target audience from hospitals to school personnel with an emphasis on school-based health staff, and we are now looking to expand to Department of Children and Family Services and foster parents and workers. Our success is now measured by a demand for training, attendance increase in participant knowledge, and a preference for question, persuade, refer versus Living Works START training. We're offering 2 types of gatekeeper training for school-based health professionals. Question, persuade, refer is a training that teaches how to recognize the warning signs of a suicide crisis and how to question, persuade, and refer someone to help. And Living Works START is a 90-minute self-guided, self-directed training that is completely online and teaches trainees to recognize when someone is thinking about suicide and connecting them to help and support. COVID-19 restrictions necessitated virtual training, and all of our gatekeeper training options are 100% online, which means that we are able to now accommodate a much larger geographic region than we would have previously. We have a self-directed option through Living Works, so people can do their training at their leisure. We have a partnership with the Core State Violence and Injury Prevention Program's COVID supplement for suicide prevention to hopefully fund additional training, and we also have potential for additional funding to sustain additional QPR training opportunities. We have strong partnerships between mental health and public health in this collaboration, and in suicide prevention and better positions Louisiana for future funding. The Children's Safety Network and Louisiana Suicide and Self-Harm Prevention are willing and able to flex to meet changes that are needed. We have sessions scheduled at the Louisiana School-Based Health Alliance in March, 2 Eventbrite sessions that are completely full, and 3 sessions at the Department of Education Teacher Leadership Summit that's in June. Our Eventbrite sessions will have a total of 100 participants, and the Teacher Leadership Summit will train at least 150 people. The team is looking to schedule more sessions in May and June and in the fall, and we are looking to target foster parents and workers and DCFS professionals, or Department of Children and Family Services. Thank you all so much for your time and attention. Thank you all to our team members that attended today. I hope you all can take something from what we shared. If anyone has any additional questions after this session, please feel free to email me, and at this time I'd like to open it up for question and answer.
Thanks so much, Nicole. That was wonderful. It was great to hear about how you've pivoted your work and how you've had to reassess what's happening in the state. So if you have any questions for Nicole, please feel free to either put it in the chat on the left or unmute yourself and say your question. Great. I have noticed that there are a number of Louisiana suicide self-harm prevention team members on the line. So is there anything else that you'd like to add to what Nicole was just shared?
Maria, this is Jane, and I just would like to give a shout out to Nicole, but also to Brittany Williams, who is our QPR trainer for our suicide and self-harm prevention. We have been working with the Family Tree and the Jacob Crouch Suicide Prevention Foundation. And Brittany has been a real trooper in this because her original job was working in the Lafayette area in what we call Region 4 and doing in-person trainings for school personnel and students. And Brittany and the executive director of the Family Tree, Marie Collins, who has been a partner in this this learning collaborative since cohort 1, they were very, very willing to look at the way they could flex sort of Brittany's role to support more trainings, especially outside of what is her typical region that she's funded for. So we're super thankful that they have been so adaptable because you guys don't know this, but Brittany has been doing these trainings for a while, and she always gets, amazing feedback and rave reviews for her in-person trainings and now for her virtual trainings as well. So it's a really strong partnership. And so we couldn't do it without her. And then Kristen Sanderson, with all of so Living Works does assist in Safe Talk training. And then because of, the pandemic, we kind of pivoted to that START 90-minute self-directed. And Kristen sets all of that up and manages that. And, that is a great opportunity for people who want to do, the training on their own time. So this has been really, the pandemic in many ways has just dramatically increased the amount of gatekeeper training that we've been able to provide across Louisiana, and we're really interested in, kind of evaluating the difference in the uptake for the different modalities, the 90-minute self-directed versus the two-hour in-person kind of, not in-person, but virtual live training. So big shout out there. And then I also want to thank Brittany Willis from Tennessee, because our team here has been talking a lot, and of course Terry Love, shout out to Terry Love from Tennessee, because we have an ED Syndro grant that we partner with our syndromic surveillance folks, and we have been working closely with Brittany and are going to replicate sort of the alerts that are sent out to school leadership around uptake or increased uptick in emergency department encounters for self-directed violence or suicidal ideation or attempt. So lots of shared learning across the states that are in the SSHP too. So that's it.
Thank you so much for sharing all of that, Jane. And we're always impressed with the connections that are made within states and also across states as well. So I'm glad that you brought that up. That's a really great example of things that are happening in the state.
Terry from Louisiana.
Hi.
Hey, I just wanted to say thank you guys for working with us. Nicole alluded to all of the changes that we made because of COVID and stuff. You guys were so graceful and everything, but specifically to Jane and Nicole for encouraging us to continue to do this. As you guys know, we tried to really ramp this up in the emergency department setting, and it just was not working out because of COVID and then because of the multiple hurricanes affecting the areas that we were trying to pilot. And so we felt kind of at a loss about it, but then, Jane came in with her cheerfulness and her encouragement, and she was just like, we can still do this. We'll just take a new direction. And then, of course, you guys there at CSLC were very graceful to us, but Nicole has really taken off, and I just want to commend all of that team for doing a great job and really working this through, and so much great stuff is coming. So that's it for me. Thanks.
Thank you. I think from my perspective, at least from working with you in the suicide self-harm prevention team, is that your system was very well articulated. You knew what was happening, and it allowed, by having this well articulated system and knowing which partners are able to work with you, which partners are not able to work with you once this disruption happened. And you had double disruptions. You had COVID and the hurricanes at the same time. then it really allowed you to pivot and say, okay, well, we have to put this on the back burner, but we'll continue. We'll continue with this work that we were also interested in working with. So I'm really happy to hear that this has helped, and it's a great reminder that we're not doing this work isolated in our individual states or in our individual systems, that we are learning from one another and also learning from each other. It's a really great example. I see Jenny is typing. Jenny, would you like to share anything with our states and audience?
I was just going to echo what you were saying, Maria. I was just going to echo what you were saying and just again say that this is such a wonderful example of the importance of being able to break your work down into manageable components, and that's really achieved through being able to clarify what your system is and who the players are and the processes involved, so that you can quickly be able to focus on doing work that's available to you when other work is not, because of disruptions such as natural disasters and hurricanes or other co-occurring horrid things like that. So this has just been a really powerful example, and I know that this is happening in other states in many different ways. So I look forward to hearing more.
And then, Maria, this is Jane, one last thing, but yes, shout out to Amanda Perry, too, because even though we kind of ceased our work with the emergency departments just because of some of the challenges with the disasters and COVID, there's a lot of great work that happened in terms of assessing all of the emergency departments on their screening practices. So there's information that we have to build on in the future. But also our department, our Office of Behavioral Health is part of it, and Robin Thomas, who's the suicide prevention coordinator, just the relationships that we've been able to forge between public health and behavioral health for suicide prevention have been amazing, and just expand beyond children. So like as Nicole's bullet point said, talked about, the participation has really better positioned us for growing our suicide prevention and our public health, behavioral health, suicide partnerships in the future, because just a lot of the relationships have really connected us to some great work, and we're supporting some great work for veteran suicide prevention and other activities, and working with homeless populations, et cetera. So it just expands suicide beyond suicide prevention in children. So lots of great stuff that happens when people work in a systems level approach and really focus on the big picture and building the relationships that it takes to increase capacity across the state.
Wonderful. Thank you so much for that extra information, that it's happening beyond the age group that we're working in the CSLC, that it's happening with adults and older folks as well. That's part of, like you said, it's part of the systems approach. So, helping build up this suicide prevention resources and system for younger folks is helping to prop up other suicide prevention efforts. So it's great to hear some positive consequences of making changes in one part of your system and having some positive consequences in another part of your system. So wonderful. Okay, so I'd like to hear from some of our audience members also. Thank you again to Nicole, thank you again to Nicole and to the entire Louisiana team for all of your great work. This is a fantastic example. But I'd like to hear from all of our audience members. How have you relied on your partners to keep your system working towards your aim amidst this disruption? What are some ways that you've worked with them? Have you relied on them entirely? We have some examples from states that have handed over the reins to their partners entirely. We have some examples of states that their main partners had to stop working with them because of COVID. So just like Louisiana just shared, their hospital partners had to stop working with them. How have you relied on your partners to keep your system going? And Have you had to re-articulate your aim? Have you had to make any of these changes? I see Sim is typing in Nebraska. Sim, if you're able to unmute, you can go ahead and unmute yourself and share what you are typing.
You don't want me to type all this in?
We prefer to hear from you.
All right, so I was going to talk a little bit about even other grantees that I work with aside from Jeanne, being flexible and allowing them to kind of adjust their market or their targets. And so one example is a lot of our grantees haven't been able to work with a lot of the different middle schools or high schools, but they have been able to get into the libraries. So that was a point of contact that was kind of new for them, but they initiated. And then I know Jeanne has some that she's going to talk about, but I just thought that was interesting to try to initiate through some of the public avenues that were open and were being used. Like at our libraries, you can come in for 2 hours and you get a tag, and once that 2-hour limit is up, you have to leave. But there's information there about injury prevention.
Great, thank you for sharing. So yeah, allowing your partners to adjust their goals and their marks and how they're doing their work. Wonderful. Anyone else want to share? I see some familiar names on our attendee list from the CSLC and some new names. So we'd love to hear from you. Let us know how you've relied on your partners or how you've helped your partners adjust to keep your system going. And if you don't want to unmute yourselves, that's okay. You can go ahead and type in the chat. I understand that we're all in different settings, different group settings these days. Great, so we'll wait another minute or so to see some more folks are typing in, and then we'll see what they are sharing.
Hey Maria, this is Nicole from Kentucky.
Hi Nicole.
Hey, so we actually started our work in the midst of the pandemic. So for us, it's just been a world of virtual meetings pretty much the whole time. So we've really relied on that connection between partners, supporting our work and connecting us with our behavioral health partner, connecting us with the regional coalition that is really pushing this work forward. So I don't know if we've had a disruption. We've just kind of started in the middle of last April, so it was actually after the start of the pandemic, but we definitely wouldn't be at the point we are with our work in progress without them.
Great, thank you for sharing that. So yes, so we've been talking a lot about systems that we had articulated or established before the disruption, but Nicole's example in Kentucky is the system that's being developed during the disruption. So it's great to hear that you're able to rely on your partnerships to build your system despite everything that's going on. Great, thank you for sharing. And I see Marie has typed in, we have received referrals from partners who cannot provide in-person programming but can send their families to meet us in outside venues. For example, we have a home safety van that has traveled to WISE and family centers that were not providing their typical in-person programming. Great, so these are some adjustments, and so you're still able to share it. And yeah, if you could let us know, Marie, what state you're in, that would be great. Wonderful, Pennsylvania, great. All right, so wonderful, Pittsburgh. Okay, we will continue on then. And if you have any other examples, especially as Jeanne is presenting or as we continue along today, please feel free to put them in the chat. We'll be happy to share them out. So without further ado, I will hand it over to Jeanne.
Great, thank you so much. Appreciate that. My name's Jeanne Bietz. I work for the Nebraska Department of Public Health. I'm in the injury prevention program, and my main responsibility is motor vehicle safety. And so I'm going to be talking about how we've kind of moved forward with still implementing our teen driver safety program, which is called Teens in the Driver's Seat. And for those of you that are not familiar with it, it's a peer-to-peer traffic safety education program that is primarily ran through schools, and in particular school organizations that take this up as a community action. And so we've been doing this since 2013, and we've ranged from 5 schools and currently having 33 schools. But this last school, well, the school year before this, of course, we ran into COVID, and the activities obviously went down significantly. And during that time and over the summer, we worked to figure out, okay, we know this isn't going away, and we know we need to figure out how to still reach schools, how to help them still do programming, because COVID is going to still be here. We didn't know quite yet how schools were going to operate. And so with the 33 schools that we have participating in Teens in the Driver's Seat, there are some that they're just participating at various levels. And that's ranging from high activity to the point where they're going to actually be rewarded anywhere from $250 to $1,000, and that's based off of activities that they submit to us on a monthly basis. To schools that they're there, I'm sending them information, but they are not participating because of COVID and how their school is structured. And then we actually lost a few schools because they're like, we are way too busy with COVID and how getting our kids back into school, and we just don't have the time for it. But it was kind of interesting because in the midst of all of this, I was still promoting the program through our Drive Smart Nebraska Coalition and our partners, and through schools. And we actually had 4 new schools come on board. And so that was very, very promising, because I figured, okay, we're not going to get shut down with all of this. Schools are still going to be in session in one form or another. So what we had to do is create virtual activities to keep program going, but it had to be based on, the various types of school attendance. So here in Nebraska, mostly our small rural schools were in person, in attendance. Our larger schools, some of them weren't even, they were completely virtual, and then some of our mid to large schools were a hybrid. And so we had to figure out how to best provide resources based on how the schools were functioning at the time. And so what we did is I worked with Teens in the Driver's Seat is actually a program out of the Texas Traffic Safety Institute, and the Highway Safety Office provides funding for us to work with them, and they provide us technical assistance. And one of the aspects of that is that they provided a lot of virtual resources, as you can see on the screen. And so what we did is we shifted from, we usually give them every school a resource kit, but this year it only contained things like tabletop banners, hanging banners, and posters. We eliminated kind of the social distance, eliminating like giveaway items, because we want to keep the social distancing rules within the school. So we didn't provide those items in the materials that they were receiving. So, but they provided a whole website on virtual resources. And so some of those resources I'm going to share with you of what we were able to do and keep schools interested, even if they were not particularly involved, but we're hoping to keep them on and keep them in the loop for next school year. So
Because whenever you can get a school that's even relatively interested and is willing to take your emails, I take it. I don't, I don't mind that at all. So some of the virtual activities that were created over the summer one was a teen driver safety app that the school students can take advantage of, and they earn points, and they can earn gift cards based on points from Chick-fil-A, Amazon, and Starbucks. Additional virtual online resources was different safety learning kits, which included railroad safety, seatbelt safety. And then one that was really popular is that they'd have online Kahoot challenges. And so they did quizzes and question and answers on different variety of topics, including the nighttime and drowsy driving. They did a one on respect the rig, on how to be safe around big rigs, especially in our rural areas. Kids are they're having to drive long distances and to be safe around big grain trucks, farm machinery, and things like that. So a lot of the rural schools took advantage of that. And then one of the other ones, and what we always try to do is we have a parent outreach component, and they developed a Ride With Me at home. And it was actually a Kahoot, or not a Kahoot, it was actually a virtual escape room where parents and teens could work together by answering the questions correctly. And they, if they answered them right, then they were able to get out of the escape room. And so we tried to provide a lot of virtual activities, especially for schools that weren't even meeting, and a lot of even the hybrid schools. Their students were, divided up, and they could at least share this through their school communication, whether the students were in school or not. So that proved to be actually pretty effective. And then schools that were in session were able to accomplish doing socially distanced activities. And here are just a few examples of that. Like one school just made a bulletin board to promote the teen driver safety app. Another school did thing around Valentine's Day and hung Valentines on student lockers. It's probably hard to read, but the one with all the wording was around respect the rig, and the school actually had students do announcements over the school intercom, so they reached all their students with this messaging. As part of Teens in the Driver's Seat, a component that we do are seatbelt and cell phone observational surveys, and so they were able to participate in those as well. And so I think we were able to at least still offer things for schools to do, whether they were virtual or whether they were in person. And then in February, we were able to still conduct our teen driver experiences survey, and that's all done through a SurveyMonkey online. So that we've been doing that for a long time, and we were still able to get a lot of schools to participate in that. And we have an evaluator that puts our stuff together. And they just completed a trend survey, which is how the schools that have been doing it since 2013, I still have them here doing it now in 2021. And we measure 17 driving behaviors of students. Students take it. It's like 17 questions, obviously, that the students answer. And this year we found that we have 8 of those driving behaviors that have seen statistically significant change, and another 8 of those driving behaviors have had significant change. So we're really excited to be able to not only bring on new schools, but keep the schools on board that we have, because we're seeing now some positive changes in behavior and driving knowledge in the long term with this, because as we know, there's always going to be new students needing this information. So we're excited about that. And then with our partnership with the Nebraska Department of Highway Safety, we wanted to do kind of almost like a plan, do, study, act cycle with trying to reach just 2 schools and see what kind of participation we would have just doing a poster or a billboard contest. And so what we did is we contacted the sponsors of the Teens in the Driver's Seat program, and we said, why don't you engage the art teacher so that we can get some of this information spread throughout the school, just not within the student organization. And so that's what these 2 schools did. They gave the information to the art teacher passed it on to their students, and we got a lot of submissions. And so what we did is the top 3 students received recognition, a recognition award. Second place, their artwork will be on a web banner or web banner on a local radio or newspaper website. And then our first place, which you see on the screen now, those are the billboards that will be put up in their local area or close to their community as we can. And so this is just another way to try to get schools involved, keep the social distancing, allow students to participate whether they were in school or out of school. And so all of this has ultimately led us to think about other things that we could do virtually and be able to reach more people, because our state is heavily populated to the east, but then when you go west, it gets just, the population just thins out. It's not as populated, harder to reach people, but with these virtual opportunities, you know, it opens it to anybody and everybody that wants to participate. So this has led us to create a virtual parent outreach opportunity to discuss with parents different aspects of safe teen driving. Topics that we plan to cover is graduated driver's licensing, what that is, how to have a conversation with your teen about alcohol and drugs, some aspects of law enforcement. If my teen doesn't follow the law, what kind of happens? And then we're going to have an insurance agent talk about that insurance and how much it costs. I'm starting to feel that pain a little bit because I have a son that's going to be driving, so I'm like, wow, really? Okay. So I think parents will appreciate that. It's not all just, you know, us, you know, talking about what we want. I want parents to have and get information they want. And then we'll have time for question and answer and things. So we've got developed a good partnership with MAD Nebraska and AAA Nebraska and our state patrol. And so we're in the beginnings of putting all of our information together and offering that to parents. And we'll get that out through our Drive Smart Nebraska Coalition and our schools and Highway Safety Office and Maternal and Child Health. So we'll just rely on our partners just to get that information out. And then the last thing that we are doing a plan, do, study, act cycle on is a law enforcement traffic safety communication survey. We're finding that kind of having to shift, like, you know, law enforcement, they really use Facebook, and it seems like they get out in the community and share information, but we kind of want to understand that better, because we feel like we can, through our Drive Smart Nebraska website, we have some great toolkits on motor vehicle safety messaging, and we'd like them to use those more. And so we're in the process within the next 30 days sending them out to our law enforcement agencies across the state, you know, wanting their feedback and understand what they're doing around motor vehicle safety and their communication methods, and if we can be of any help to improve those or provide resources for them to participate in that in a little bit more than they are now. And so if you have any questions, please unmute yourself or type in the chat. And I thank everybody for their time, and I'll turn it back over.
Great. Thank you so much for sharing all this wonderful information, Jeanne. I particularly enjoyed the billboards. There's something about having teens part of the marketing towards teens, trying to get the messaging across is really fantastic. I think it's a great idea. So we have some chat questions that have come in and some conversations that are happening. We have a comment from Jane, Jane Herway in Louisiana. Those billboards are amazing and would love to see your 17 survey questions if you can share. So if you are willing to share, we would love to share them. And then we have another comment from Autumn Holmes in Wyoming. What was the app called that you used? And she's curious to look at it. So if you could talk a little bit more about the app.
Yeah, the app is actually on the Teens in the Driver's Seat website, and it's t-driver.com. And so you can go online, and any student can participate in it. So so that's where you would find the information on that.
Great, thanks. And Kate just entered the link in our chat, so you can definitely access it through there. Wonderful. And I think that just like Louisiana, this is another example of a very well-articulated system of motor vehicle traffic safety that, you know, you had this very good partnerships. They were a very well-articulated plan and aim from the beginning, which allowed you then to make these shifts. And, you know, one of the concerns going into the pandemic was, of course, with teens delaying their driving tests or potentially driving without having taken any driver's ed. So this is a really great example of how you've stayed ahead of that in Nebraska. Do we have any other questions or comments or things you'd like to share?
Hi, Maria. This is,
yeah.
Sorry to intrude. This is Jenny from Children's Safety Network. And I was just curious, thinking about what you were just saying, Maria, and the Louisiana example. Jeanne, I'm also familiar, you know, as you were able to continue to maintain momentum despite school closures and then adjusting to the variability of how schools reopened and their capacity to continue to focus on including teen driver safety in their curriculum and school environment. I know you also, similar to the way that Louisiana was able to step back and look at your system and what your aim was, you were able to identify, you know, some other partners that you might be able to pivot your attention to. And I'm thinking in particular the work you described with looking at law enforcement and also your attention that you started to give to other types of driver education curriculum and the work of the Department of Motor Vehicle. And I was wondering if you could share a little bit more about that work, because it's a great example of doing concurrent work on many different facets to help keep momentum despite disruptions.
Yes, thanks for that reminder. It's funny how a guy forgets things, but yes, with the law enforcement, that started because we have like a whole, we have some really good materials for graduated driver's licensing. We have informational card on driving restrictions and then a parent-teen driving agreement. And we saw that really law enforcement wasn't really using it that much. And we know that a lot of communities have like law enforcement that just focus on community outreach. And so, and they're a pretty stable organization, so they're not going away anytime soon. And so we're like, we really need to tap into some of that and provide services and support if they're wanting it. And so that's why we're trying to gauge kind of where each department is on how they address that, because some of them have really, you know, good outreach and have a lot of followers on Facebook or Twitter and Instagram. And so that's why we kind of turned focused on that. And then in the meantime, I've always kind of been working with our Department of Motor Vehicles, and I caught wind of the fact that they were updating we work a lot with driver education instructors across the state, and we provide them with GDL information. And I started reading about what our driver's ed curriculum was required to teach. And it's, you know, pretty much what you would think, but they were missing something that I thought was very important, which is they never talked about our graduated drivers licensing driving restrictions. And it's like, well, how are they supposed to even know when they can drive and how many passengers and things like that? They pretty much talked about seatbelt use and cell phones, and that was about it. And so during that time of COVID, they were updating these standards, and I submitted my recommendations to our Department of Motor Vehicles, and they said we need to have this in here. And so currently it will be a requirement for our driver's ed instructors to talk about those driving restrictions, and we will have materials available for them at that time. And so hopefully those standards will be approved soon, and then we'll get back into touch with all the driver's ed folks, tell them, hey, you know what, this is a new requirement, and we have some really nice free materials from the Office of Highway Safety that you can use. So we're always trying to find ways to dig a little deeper into our teen driver safety programming and spread it out across a larger area, especially too adding the parent component in there. So we just try to dabble and get our hands wherever we can, wherever kids are, wherever parents are. And that keeps growing every year. We always find out about new things.
Great. Thank you so much for sharing that, Jeanne. And it's a really great example of how you're thinking out of the box and really trying to dive in, like you said, to different aspects of your work to see what else you can continue improving. And I'd like to also give you a shout out for you've mentioned multiple PDSAs today. So it's really clear that you're working on, you're running multiple PDSAs at the same time, but they're on different ideas with very specific goals in mind. And that's fantastic to hear. It's a great example, and I do encourage anyone else who's interested in this to contact Jeanne if you have any other questions about how she's doing this and how their team is doing it. Great, and it's a huge, Jenny is congratulating you in the chat also, Jeanne, on your success with the Department of Motor Vehicle, that it's a big win. So thank you very much, Jeanne, for presenting today and sharing all of this wonderful information about what's happening in Nebraska. If you have any questions that may come up in the next 20 minutes or so, you can definitely put it in the chat and we'll see it and respond to it. Wonderful. Okay, so I'd like to take the next couple of minutes to talk a little bit about the Child Safety Learning Collaborative and how we've been supporting our states during this time. So here's a map of all of the wonderful states that are participating in the Child Safety Learning Collaborative right now. We are working across 4 different priority topic areas. We're working in bullying prevention, motor vehicle traffic safety, sudden unexpected infant death prevention, and suicide and self-harm prevention. So we heard examples today from suicide, self-harm prevention, motor vehicle traffic safety. But we also have teams for the other 2 topics. And one of the things that, we've been doing is really making sure that we're listening to all of the challenges that are occurring. If you could mute your lines, I'm sorry, we're hearing a lot of background noise. Thank you. So we're taking note of all of the challenges that the states are articulating to us during our team meetings. So for any of you that who are not familiar with the Child Safety Learning Collaborative, we have meetings once a month, once every 2 months we alternate between the state technical assistance webinars and then our topic meetings. So during topic meetings, we are very intent on learning about any challenges, of course, hearing the successes, celebrating those successes, and making connections across states within the CSLC and even across topics if something is happening that could affect the other topics as well. And we're being very responsive and creating tools and helping the states work through some of these challenges. And so here we'd like to start, we'd like to focus a little bit more on this idea of the partnership. So we started off with our state system, and we're starting off with this with our aim. We have our articulated system. We have our partnership. We're developing our partnerships now in order to get to that aim. So our partnerships are super important to making sure that we can extend the reach and impact of our prevention strategies and programs. We can get feedback from our partners about what they've been experiencing on the topics that we're working on. We can bring together different organizations, networks, or funding sources to plan, implement, and evaluate a wide range of injury prevention programs. Will hopefully reduce duplication efforts, because now if everybody knows what else is going on in the system, maybe they don't have to, not every organization or every partnership or every partner has to do the same thing. We can, or if from a state perspective, if you see that partners have been doing something for a very long time, you don't have to recreate it from the state perspective. You can rely on your partners. We can also leverage opportunities to integrate child and adolescent injury prevention into non-traditional areas, and we heard a little bit of that today as well. A couple of examples from different topics were if there might be a home visitation program for some other reason. We know that there are a couple that are promoting safe sleep, for example, and it could integrate information on falls prevention or on poisoning prevention as well. So there are ways to cross over our injury prevention topics also, and this is all capable if we have established partnerships and well-articulated goals in mind. Some of the observations that we've made about partnerships during COVID-19, I've created two columns here, and I'm sorry the formatting on the slide has come up weird. But we've had observations about partnerships within the CSLC and then within state systems. So we'll start off with the observations that we've seen within the CSLC. One is that mentorship between states encountering similar challenges at different stages is super important. Then you've heard a little bit about that, of how Louisiana has reached out to Tennessee for some help, and this has been ongoing within our team. And also within the CSLC, we've had instances of requiring additional technical assistance from the CSLC co-managers. So from myself, from Jenny, from Aaron, and Jim, who are our other co-managers as well. And we will be talking about this more extensively on an upcoming CSN webinar. It's a public webinar on May 5th from 2 to 3 p.m. Eastern Time. So if you're interested in hearing a little bit more about this, we will be talking about it during that webinar. So we'll focus the rest of our chat today on the column to the right, which is within the state systems. We've had examples of states within the CSLC that relied more heavily on their partnerships to complete the work. In some instances, the entire state team has been taken off of their normal duties and focused specifically on COVID, whether it was contact tracing or now with the rollout of vaccinations. They've been taken completely out of their normal activities, and so those states have relied much more heavily on their partnerships. And having a very articulated system and having the partners know exactly what their position is in this system has allowed them to do that. And some states realizing, like Louisiana, that some of their partners are not able to continue the work during this time, and they've kind of had to put that work on hold, had to conduct some new stakeholder analyses to find new partners that are able to work on some actionable items during this time. And some states have been able to continue as planned with some modifications, of course, like Jeanne just shared all of the modifications that they were working on. We know a couple of the other states that are on this call today have had made some modifications, like creating, putting all of the trainings that they usually do into a virtual environment in order for them to continue their work. So we've had these modifications, and some modifications have been approved by the official, the creator of the evidence-based program. Some have been in conjunction with them, like they're piloting these new adaptations. So this is really important to have the aim in mind, why you're doing this, and then all of your partners map all of this out so that your partners know how they're working with you, but also how their work is influencing and working with other partners across your system. So Jenny has just shared in the chat that a key tenet of quality improvement is to steal shamelessly and share seamlessly. And so we're definitely seeing that happening in the CSLC. So we want to remind you, of course, that your partners can help you connect the dots. And I know that I'm going back to this, this fish connect the dots, but I want to remind you that this is a 2D image. And so one of the things that we've heard also from states is that they've done a lot of background work. They're doing work that's not public-facing because they can't necessarily interact with the public, but that they're doing background work. And some of their partners may be doing this work as well. And so I wanted to have you all imagine that this is actually a 3D image. So if this was a live fish, it would have a back to it, right? And so in some of your partners may be connecting the dots on the back of this fish. And so the public might not be seeing it, but these are all necessary processes so that you can continue your work and also propel your work forward once the pandemic is over and we can go back to our normal activities or whatever our new normal activities are. So keep that in mind that, work that's happening in the background and work that's happening to articulate your system, to develop new partnerships, to find new ways of thinking about your work, and taking the time to reflect on what needs to happen and why it needs to happen is just as important as the forward-facing work, and the public-facing work. So if you find yourself connecting some dots, but then seeing that you're not seeing public results, this is necessary work that's still continuing. So we can always keep building your system with your aim in mind. So the examples that we heard today were two very well articulated systems. They had their aims in mind, and they had their inputs, they had their resources, they knew their processes, they were developing their processes, and so they were able to, during these disruptions, say, okay, we're going to put this thing on hold, we're going to continue moving into a different direction, and really continue finding new measures that helps them articulate how they're working towards the aim of the system. So this is really important to keep in mind. And when you if you have any questions about this, and this map in an editable form is in that our framework at the top in the web links. So if you are interested in working on this, or you start working on it and you're kind of stuck, you can always contact us for technical assistance, and we can help you out. So that brings me to how CSN can help your state and jurisdiction. You can check out our website, childrensafetynetwork.org. You can read our resources. This is the same link that's at the top. You can request technical assistance from us at any time. And definitely keep in touch about the Child Safety Learning Collaborative. We will have a third cohort coming up. So we will be sending out an announcement about that, and we will be putting it on our site as well. And of course, if you're not part of the newsletter mailing list, please go ahead and sign up on our mailing list. Do you have any questions or comments, concerns? Jenny, I see you typing again. Would you like to share what you're thinking?
Last month they didn't say that it was a problem, and I did the same thing.
I see Jenny entered in the chat the link to our resource on the framework, and also that cohort 3 will begin in November 2021, and that applications will be available this summer. So keep an eye out on that if you are interested in joining us. Great. Do we have any other questions or concerns or comments that you'd like to share, things that you'd like to hear about?
All right. So what's the additional?
Okay. Great. So we will send you to our evaluation, and we are always in a constant state of quality improvement ourselves. We practice what we preach. So we would love to hear some feedback about our state technical assistance webinar today, and let us know how we're doing. And if there's anything else, any topics that you'd like to hear about in future stalls, please make sure that you include them there. We would love to hear from you and see what you'd like to hear from us. So please take a look at our website again, and be sure to check out our framework. If you need any technical assistance, we're here for you. Thank you to all of our presenters today, to Nicole and Jeanne, and to your teams. And thank you for all of the excellent work you're doing and for giving us about an hour and a half of your time. Thank you so much to everyone for attending, and we'll see you all next time. Thank you.